Our mother was born in a small country town called Branxholme, just west of Hamilton, and she grew up there on a country farm, and then had some education in Melbourne before she went home to look after her parents. Her great passion really was about looking after people who are in adult age and older age, whether they were neighbours, whether they were parts of a immediate community, or whether they were people that were struggling because of health or social disadvantage.
When you look across every single health indicator, the disparities between metropolitan and rural are really evident. Rates of many of the common conditions, chronic diseases, are high in rural communities. And I think most people know about some of the terrible mental health issues impacting on rural and remote communities. We have some of the highest rates of suicide.
Being able to partner with a School of Rural Health that's based in regional Victoria was a real strength, and it's also a way in which we can help memorialise the contribution she made during her life.
What makes our research so unique is that we get out into those communities. We work with community members to really look at the evidence, what's really going on in their community, to be able to prioritise what they wish to focus on. So this is really about rural people taking back the power and control to some extent to be able to drive what they need in their community, rather than something just being translated from Melbourne to a small community in rural Victoria.
If someone were thinking of being able to donate money to La Trobe University, I would be encouraging them to do it, because there's a lot of wonderful things that La Trobe can actually do if it has additional funding to be able to do it. Through the School of Rural Health and the VV Marshman initiative, we think that La Trobe's research and the ability of that to translate that research into local communities really will make a difference, and it's exactly what our mother would have wanted.